My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
We wanted an international airport and a Costco, and it had both of those.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community. I wanted to say hello and tell you a little bit about my experience and some of the things that I love about our emergency department in particular.
Hi, I'm Dr. Hafner, and I serve as the program director here for the Emergency Medicine Residency Program at OSF St. Francis Medical Center and the University of Illinois College of Medicine at Peoria.
Hello, my name is Andrew Vincent. I am the assistant program director for the Emergency Medicine Residency here at University of Illinois in Peoria.
Our program has been around since about 1984, or 36 years of residency. We've graduated a great number of emergency medicine residents who practice all over the country and some even internationally. The first area that I feel makes our program really special is the people that we serve. Our patient population is really three separate, distinct, but intermingled groups. We have a very large academic medical center here that serves a variety of different medical specialties. And because of this, a lot of patients from all over the region come to St. Francis Medical Center for their medical care. We have a lot of complex patients, including home ventilator patients, LVAD patients, complex strokes and neurological conditions, as well as a myriad of pediatric disorders. These challenging patients are part of your everyday experience here at St. Francis.
The pathology here is quite impressive, I would say. We have a lot of sick folks that come through our emergency department, and we get a large array of procedural opportunities in addition to caring for very critically ill people. We have a very wide spectrum of disease and pathology, and I feel like our residents have the ability to take care of really anybody after they graduate here from residency.
The third patient population that we serve is as a community medical center. Many patients are seen by OSF physicians and OSF specialty physicians and utilize OSF St. Francis Medical Center Emergency Department as part of their PPO or part of their usual care for community medicine. Some of the strengths within our programs are our pediatric curriculum and working in our own pediatric emergency department. We couple that with the Children's Hospital of Illinois, which is a full-service pediatric hospital located on the same campus as OSF St. Francis Medical Center. Another area of strength within our residency is that of emergency medical services. Life Flight is a 4-helicopter program located at OSF St. Francis Medical Center that flies over 2,000 missions annually. Our residents participate in this experience through both elective and scheduled flight rotations. Our residents also participate in ground-based EMS services and tactical emergency medicine. In our emergency department, our patients are very sick and have a high acuity level. Oftentimes admitted to a critical care facility, there are a plethora of different procedures that are available to our residents. There is no orthopedic residency or anesthesiology residency at St. Francis, so we are able to perform all of these procedures ourselves. Our residents have quite a bit of procedural experience during their residency stay here.
We have a great working relationship with JUMP. We have faculty that are primary faculty at JUMP that are emergency physicians, which I think lends itself very fluidly to us utilizing JUMP and all the simulation services, as well as doing research projects. And I think that simulation in particular really fits EM better than most other specialties. And we have a very robust simulation faculty and a very, very robust simulation curriculum. And we have a trained fellow, and he also manages all those cases and sets up a lot of educational opportunities that really are hard to find anywhere. I think JUMP is top 10 in the world as far as that.
Another area that I feel that we're particularly strong in is with our faculty. We have over 50 faculty members that serve in a variety of roles within the residency department, many who have been here for many decades. Their wealth of experience as well as knowledge really serve as you're giving direct care in the emergency department. Our faculty are friendly, personable, and always willing to help.
I did my residency here at St. Francis, and so I have both perspective of a resident and an attending, which I think is can provide useful information to you about my experience. So one of my favorite things about this department is the relationship I have with our residents. So as a resident, I remember feeling as I moved through my residency, I developed more of a colleague relationship with my attendings. We both had opinions. My opinion was valuable to them. They would ask for help on some of their patients, even if it wasn't mine. If they needed a second opinion or a second set of eyes, they'd come and find me. The first time that happened, I remember thinking, is this a secret test? Are they trying to test me in some way on this x-ray image? And nope, they actually just wanted to know what I thought and if I saw something they missed. Another thing I really love are the women that I work with. So as a woman, this is something that I hold near and dear to my heart, and I have a personal investment in. And I'm a little embarrassed to admit that I did not really appreciate the women that I worked with until I started interviewing for other positions to become an attending. On the interview trail, I started to notice the glaring lack of women. You know, the people who interviewed me were men. The people I met with in the emergency department were men. The people at the dinners to welcome me were all men. And I just thought, where are the women? And so it was something that then in hindsight made me look back and start to appreciate the strong leadership and women who had gone before in our department. The doctors Robin Minersky, Lucille Fendrick, Mary Baker, Gardner, Krasaniak, Heisler, all of these really strong women that had set this tone in our department of strong female leaders. And I didn't notice it because it was the norm. It wasn't something confusing or surprising. It wasn't an anomaly. It was the way our department was run. There were strong female attendings, and it meant that as a resident, I never had to set the tone or convince people that I should be an attending just because I'm a female. That was a hurdle that had already been blown over by previous attendings, and I really am thankful for that, and it is my honor to be able to continue that tradition and kind of carry that torch for future women as well. So that's something I really love about this department.
This is a great place to be and a great place to train. I did my residency training here almost 10 years ago, and my family and I have decided to stay around for the past 7 years after residency, partly because of the community and also the close ties that we have to the people within the program.
And that continued throughout my residency, and it was one of the things I really loved. And a big reason why I wanted to stay here as an attending, because I enjoyed that relationship so much.
It's great when you find a group of people that you really trust and have a lot of reliance upon. And I know that everyone here would have my back in any situation. and we try to treat our residents the exact same way.
I think there's also a lot of laughter in the emergency department. Emergency medicine can be a really challenging field. There's a lot of heavy weight that you have to carry all the time. And when you can add that levity, that enjoyment of your time, I think it's really important and helps with the longevity of our career. So that's one of the things I really love about the emergency department.
The University of Illinois College of Medicine at Peoria and OSF St. Francis Medical Center is an area that you can flourish. I think as a fourth-year medical student, many are concerned that they need to do residency in a program that's going to provide them both excellent patient care opportunities as well as a nurturing environment that provides many educational opportunities.
If you push yourself during residency, you have the opportunity to go, you will be able to and capable of going anywhere and working anywhere in any situation, whether it's a small community ED or a huge level 1 trauma center, academic center.
Hi, my name is Julia Samanda, and I'm from Wausau, Wisconsin.
From Markham, Ontario, Canada.
From Joliet, Illinois.
From Rockland, California.
From Kansas City, Missouri.
From British Columbia, Canada.
My name is Helen Ashraf, and I'm a third-year emergency medical resident and one of the chief residents for the 2020 and 2021 academic year.
Hi, hello. Didn't see you there. My name is Gary Bagat. I'm a third-year emergency medicine resident here in Peoria, Illinois. I also did med school here in Peoria, Illinois with the University of Illinois College of Medicine.
So I knew that there was something special about this program immediately.
I loved my time in Peoria as a resident and as a medical student.
Some things I like about our department is how supportive our faculty are.
I can honestly say it was an incredible training experience there.
I really wanted something that was family friendly and well-rounded.
I moved to Peoria not really knowing much about this city, and I can say without a doubt that it was one of the best decisions I ever made. This has really become my second home, and I've learned so much since I've been here, and I love this place so much.
Peoria in and of itself is a hidden gem within the Midwest and within Central Illinois. The cost of living is pretty low here, the salary is good, and there's a lot of extra perks you'll find in a small town in Peoria that you might not get in a big city elsewhere.
You have an incredibly supportive learning environment, and the volume of patients that you see is incredible.
Here's one of the benefits of coming to Peoria is you get to put in some work with Life Flight.
I really encourage you to look into this program because there are so many wonderful benefits and you'll have a really great experience if you train here.
Hope to see you in Peoria.